Then we will go on to vaccination, which is again a very important aspect, wherein we need to know that this is the key piece of precaution that we can take even before management. So the second last thing would be management around COVID-19. And of course, a small little note about what to expect post-COVID, what are the complications and how to manage the same. So without further ado, let's just move on to the session. So introducing you all to the topic, I know all of you all are well aware, and we have recordings to go through, and we are all watching the television, we all watch the news and everything. So what are the symptoms? The most common symptoms are the following. It's fever, dry cough, and tiredness. So what is the second wave brought to us, which is different from the first wave? So of course, there was a loss of smell and taste, but this is supposed to be the key symptom that one can experience. So even safely, clinically, if we doctors want to assess anybody with a COVID-19 vaccine, this is one of the key symptoms that we are seeing in patients, which is loss of smell and taste is the first key thing. Followed by, of course, you all would have, heard from others like, a running nose, a blocked nose, a sore throat, a itchy throat, then any difficulty in breathing, headaches, body aches, joint pains. These were all there in the first wave also. The second wave has brought about certain GI symptoms also. So apart from the respiratory, what we just saw, in the second wave, we are seeing a lot of nausea. Nausea is the feeling of, one person is going to puke. Then vomiting and loose motions. Loose motions is diarrhea. And then we're also seeing certain patients with pink eye or red eye. And then there are certain skin rashes also that are appearing. And also discoloration of the fingers, fingernails or the toenails or the fingers or the toes per se. So these are the symptoms to watch out for. So moving on to who is at a risk of COVID-19 vaccine more than the general population, right? So for that, we'll have to see, the tabular column, which is adjacent. So anybody who's above the age of 60 years is definitely at a more risk. Anybody who's been diagnosed with a heart condition, who's had a recent heart attack, who's had a procedure done, which is called a CABG, or, who's had a cardiovascular accident like a stroke in the past 6 months, or who's being diagnosed with a heart failure, or who generally has, a lung disorder like a chronic COPD. Like, COPD could be like, you must have seen somebody in the family or somebody in your close-knit circle having chronic cough. It just doesn't go away. So that's a COPD, okay? Then, certain asthmatic cases. So these people are definitely at risk because their lungs are already compromised, right? We all know that this infection is actually targeting the respiratory system, more so the lungs, and it's also triggering off the inflammatory response in the body, right? So any condition, any of these above conditions, like I said, an asthma, which is not being controlled very well by medication, or, certain chronic other common conditions like a diabetes or a hypertension, which is also not being controlled well. So if there is a chronic condition and if it's being controlled well, then the person is not so at a risk, right? And then anybody who's been diagnosed with a cancer, with a kidney disease, with a chronic liver disease, or who's just maybe received a transplant, right? Also, who is generally on an immunocompromised state, like, a person could have a HIV infection, could have, like I said, received a transplant, or could be a cancer diagnosed patient. These are all the immunocompromised, or even who are on long-term steroid medication, right? We've also seen people who are on the morbidly obese side also posing as a risk factor for them, right? And in the children, among the children, since I want to put this note because we're seeing children getting affected in the second wave, right? Or the younger population, not so much in the first wave because it was more of a disease of the elderly, right? So if there are any children who already have any coexisting morbidities like diseases, like, a congenital system disorder like of the lungs, of the heart, or they're already on a nutritional deficiency, they are more prone to get a severe form of the infection. And of course, family members of COVID patients, like we all know, right? So because they're close contact and they could be at a high risk of getting the infection. So now, since we've learned what are the symptoms and which is the population rather, which is at more risk, let's move on to the precautionary measures, right? So this is something that all of us need to know, and all of us have kind of probably by-hearted it by now, right? What are the general precautions? So let's go through the general precautions for everybody. right? So I think hand hygiene is one thing that we've all mastered. We need to keep frequently washing our hands with soap and water where it's available, or use a alcohol-based sanitizer, right? And refrain from touching the eyes or the nose or the mouth unnecessarily without sanitizing the hand. And of course, there's respiratory hygiene that is being talked about, right? You either cover your mouth and your nose when you're sneezing or coughing, or at least use the your sleeve, right? And wearing a mask all the time, whenever you either step out, even if, whether you live in a gated community, whether you're stepping out for a walk, or whether you're going to pick your groceries, or whether you're actually going to a place where you can't avoid, right? So definitely you'll have to wear a mask, and that's very, very essential that you cover your nose up until the chin, right? And you maintain a distance of 6 feet, which is a meter. Right. So we've seen patients, coming and telling us that, I was all right, but, I had this chat with my friend and he kind of was quite close to me. And we had like a chat for like 15-30 minutes. So we've seen that an exposure, which is less than 6 feet a distance between each other, and an exposure of more than 15 minutes is posing a huge risk. Right. So we need to be cognizant of that. And of course, if we have to go out for our daily chores, then come back and immediately, discard all the clothes and put them for wash and have a bath, right? That's the best thing to do. And the grocery items and all of that needs to be sanitized. If it is in a packed format, or if it is like vegetables, you need to wash it with some warm water, and salt will do the do, right? You don't need anything fancy around that. Apart from that, how do you right? So immunity and boosting immunity, and a lot is being spoken about that. Why is it being spoken about that? Because we see that, patients who have a better immunity are fighting the disease much better than the population which has a lower immunity, right? So what is it that is going to help us? Definitely, multivitamins and nutritional supplements are proven to, keep the person up on the protection end, right? Or, having infused water with, our humble spices and herbs that we have in the kitchen, or making a herbal tea out of it, right? Like, a ginger water, or, jeera, or tulsi leaves, or just our humble black pepper, right? And you would all remember the household remedy that our grandmothers used to give us, right? With milk and turmeric powder. That still holds good. So you can do that as well. Right? And steam also has been helping certain individuals to keep the infection at bay, and saltwater gargles, of course. So around the general precautions, we will continue with the same. So I just wanted to give you a keynote about, everybody has this doubt as in, what is it that can I, include in my diet to, protect myself? So the first and foremost thing for the general population is, of course, to have a balanced meal, right? So, not a very heavy one on the carb, but a balanced one, right? So we all know the concept of the healthy plate. So just to give you a brief index as in how you need to assess whether your meal is balanced or not. In a plate, if we divide that into half, right? Among one half, the major portion will be your carbs, right? And the other half will be divided with the vegetables and your protein, while the rest is going to be all your multivitamins, a little bit of your milk and milk products, and very, very minimum of fat, which could be either from your cooking oil or from your ghee. So this is a good index to keep in mind. And then protein-rich diet, of course, because that's also proven that it helps in recovery, and it helps in people who are like keeping themselves active while exercising. We kind of see that their immunity is also balanced in that way. And we have certain foods which are rich in antioxidants, right? So that's the catchy word nowadays. So, any food which is like, mushrooms, tomatoes, or capsicum, and green leafy vegetables like broccoli and spinach are top on the list, which are like key and very rich in antioxidants. And so that also can, build that immunity and give you that resilience against the COVID infection. Of course, not to forget, like I said, the spices and the herbs that we have. We have, gooseberries and vitamin C rich foods, right? And of course, turmeric also is like a magic ingredient. So moving on the same note around the precautionary measures. So that's about diet, right? What we saw. So next, sleep. We're also seeing that, wherein individuals are, catching up on their sleep, not losing out. I understand it's a tough time for people who are like trying to balance work and home, especially for the girls, because they have to run even their household chores and, take care of their work. But, you should kind of get that quality sound sleep which is, uninterrupted for 7 to 8 hours in a day, right? Because I'll tell you why. Because one, your immunity is getting boosted while you're sleeping. Your entire immune system and your entire cardiovascular system, your respiratory system, they're all getting rebooted, right? Like how you restart your system. So this is how your system gets restarted. If you sleep and you get up with a refreshed morning. So you should definitely do that. And exercise, of course. So a lot is being spoken about exercise also, right? So just do what you want to do, what keeps you comfortable, what you can fit into your daily routine. It could be a brisk walk, it could be, walking your pet, playing with your children, doing your household chores, maybe dancing, maybe swimming if you have the leisure to do it, in all of these activities. But you've got to do it on a daily basis, on most of the days in a week. And, around 30 to 45 minutes is a good target to keep. Right? Whether you're hitting it or not every day, try to do it on most days of the week, right? And of course, everybody is stressed, right? One could be the pandemic, one may be working from home, or maybe balancing your household duties, or, taking care of the kids who are like constantly out there taking online classes. And, even the pandemic situation creating that anxiety in you. So you should have certain basic coping skills within yourself, maybe talk to a true friend, share your feelings with your colleagues, somebody who's trustworthy, right? Or, have a chat with your parents, check out on your friends, on your colleagues, how they're doing, and, practicing gratitude, and, reaching out for help. It's not bad to reach out for help whenever you feel like, right? You can feel low on certain days. So don't hesitate to take help, right? You can always go ahead and do that. And remember, keep visitors as minimum as possible and actually avoid them, because you never know, right? You want to protect yourself and them as your family and as well, right? So it's mutual. So these are about the general precautions, right? So I'll be happy to take any questions after the session. So if you have any, just jot them down. So let's go on to the precautions for, people who have medical conditions. What should they do? Right? So definitely, like I said, though they are at a risk of COVID-19, right? But there's still a ray of hope, right? All they have to do is they have to manage their known condition well. They have to take their medicines regularly. They have to constantly keep in touch with their treating doctor, their family doctor, follow their advice, be compliant and not complacent, right? Take their diet advice, take their lifestyle advice, take all their medication advice, take them on time, and maintain a small little diet if you have the habit of forgetting your medicine, right? Or maybe, talk to a spouse and take them into confidence and ask them to nudge you whenever you need to take medication. And proactively report any medical complaint immediately to your treating doctor. And have your medical reviews regularly. Either it could be on an online consultation or over the phone, or any tests that you need to regularly take. So if you're due for a test, do not hesitate, right? Take all the precautions that are required and get a home sampling done and forward the report to your doctor. I'm sure the doctor will be ready to oblige, right? And one more thing that you really need to take care of, and this is especially for people who have multiple disorders, right? So a person could have more than one condition to take care and maybe having more than one medication to take care. Always review it periodically with your doctor and learn about, certain drug interactions, certain things, certain medicines that you should not be taking together, certain medicines that you should not be, certain food that you should not be taking with your medicine, because it could bring down the efficacy of the medicine, right? So the bottom line is just maintain your condition well, and I'm sure you'll sail through this pandemic, right? And a small little note for children, right? What do we do with children? Children running around, having no school to attend, wondering what they need to do with the online classes. So what do we need to do? And what can we do for them during this hour, right? What we can do is we can kind of reinforce and train them around the cleanliness aspect that they need to know. And it's a need for the hour, right? So sorry about the typo. So what they need to know is how well they need to wash their hands and how frequently they need to do it. And, when not to touch certain surfaces, and be very wary of, washing their hands when they use common areas, like maybe the common play area or maybe the common corridors in your gated apartment, or, certain public places if they have to go there, if they can't avoid it, right? And they should just keep a separate set of clothes when they are stepping out of the house, and probably change into different clothes, or cleaner clothes when they're at home. Because, you never know. There could be an elderly person, there could be a person with a comorbidity, right? and cultivating certain good habits in them. So take this opportunity and introduce them to reading, which is a beautiful habit to have, right? Helping them, taking their help in small little household chores that they can do. Maybe they can water the plants for you, maybe they could set the dining table for you, or maybe they could just take care of a sibling or a pet, right? So that way you're inculcating good habits in them, and you're giving them a bit of your responsibility and probably sharing the burden there, right? And you can also create a study routine. So this is probably for the older children, right, who are maybe in middle school or high school, right? So you can help them create a study routine, because being at home itself is being so laid back, right? So you can't expect them to be that active and that well on their toes while the teacher is trying to teach them on an online platform, right? So set a protocol for them, set a routine saying that from 8 a.m. to maybe 12, let's not do anything else other than studies, and create that ambience for them, right? And also we have to be very aware of the child's feelings as well, right? They could also be stressed. So just look for any new behavior that they're showing you, or any form of stress that, any irritability, any anger that they're trying to, show at their sibling or maybe at you. So just address that and see if it's a regular pattern, and do seek help for the same, right? And do not deter from going for medical reviews, right? So a child could be, maybe due for a vaccine. Talk to your doctor, talk to your pediatrician, and have all your doubts cleared. And see if it's safe to take your child out there to get him or her vaccinated, right? So these are the general precautions. So we'll move on to the next section, right, which is around home isolation.
Doctor.
So
sorry, hi, doctor.
Yeah.
Doctor, there were a few questions that I had received which were related to some of the things that you spoke about. Is it okay if we talk about them? Otherwise, I think it might just get. Since there's going to be a lot of content,
sure,
I thought.
Sure. Yeah, you can read out the question pages.
Yeah. So a couple of them, doctor. So one common question in terms of prevention that a lot of people seem to ask is, does taking steam work to reduce chances of COVID infection? There's three questions actually. Maybe you can see how you.
Yeah, go ahead.
The first one was the steam one. Second one is, can we take multivitamins as a precautionary step? And third one is double masking effective? From a prevention standpoint. So if you could clarify.
Definitely. Thanks a ton. Okay, so to answer your questions, right? So steam definitely helps, right? So how does it help? The mechanism, it cleanses the nasal and the upper respiratory tract, the tract, right? So it cleanses it of any minor discharge or any dust or anything that is there, and it definitely helps, right? So we've seen that steam is helping. Maybe twice a day is a good frequency to take for people who are affected or not. Either ways, it helps. It definitely helps. And maybe you can add in 2-3 drops of eucalyptus oil to it, or even plain water can help, right? Clean water, like you could use clean drinking water. The second thing, to answer your question, yes, multivitamins can be taken by everybody, irrespective of whether they're infected or not, just to give you that boost around your immunity, right? And like somebody just posted it there, yes, it is an over-the-counter medication that you can take, right? And the third question around double masking, no, double masking is not so, useful. A decent mask, which is like, which covers your, so the way in wearing the mask is very important. So double mask doesn't help, right? So it is the one and the same. So you wear a mask, it may have to be an N95 unless you're taking care of somebody who has COVID, right? Then an N95 mask is advisable. Or if you're like, going into a crowded place, or maybe, going out to a hospital where there is high chances of infection, then it could be advised. But otherwise, a simple plain cloth mask, which is covering from your nose up until your chin and is not leaving out any gaps, right? So that is very, very important. And when do you change your mask? You change your mask if you're wearing it continuously for 8 hours. You change it once every 8 hours. Or if it gets soiled or wet, you have to change it immediately, right? And you don't have to wear the mask at your home unless you have somebody who's isolated or somebody who's already tested positive. Then you should wear a mask at home. All the others also should wear a mask, apart from the caregiver themselves, okay? Otherwise, you need it only when you're going out in the public, or when you're going to common areas, like if you live in a gated community, if you're using the lift, if you're using the corridor, if you're going out to dry your clothes, or maybe, just taking a walk, then you definitely need to use it. So the dictum is, when you're coming into contact with other people, you definitely need to mask yourself. Okay? Anything else, Tejas? I'll be happy to answer it before we move forward.
We can move forward there.
Around this.
Yeah, there's a few more, but maybe we can take it in the next break.
Lovely, thank you. So let's see around what are the do's and don'ts for home isolation, right? We hear about being home isolated or anything. So who are the eligible category of people who need to be home isolated? Sorry. Yeah, sorry for that. So the first thing is, who needs to be home isolated? So anybody we've seen, I will show you a slide. I've put up a slide wherein you can actually categorize the severity, but not going into the intricacies now. Anybody who has a very mild condition, who is like pre-symptomatic, like we all have had that phase where we feel kind of sick before we fall sick, right? So that is the pre-symptomatic phase. Or somebody who's like asymptomatic. So the person has no symptoms but is tested positive, right? So that person is an asymptomatic case. So all of these cases are eligible to stay at home and isolate themselves and follow these following precautions, right? So what should they do? Ideally, they should have a separate room for themselves, and they should always be in constant touch with their treating doctor, right? And who are the ones who should not be home isolated, though they are a mild case, right? So like we said, people who are immunocompromised, right? Because they're already low on their immunity state, because they have an ongoing infection, they've just taken a transplant, or they could be, cancer patient. So they are not eligible. They have to get into the hospital care, right? So the second thing who will not be advised to stay at home is an elderly person who is above 60, because we see geriatric care needs more care and more support. So that cannot be given at home, right? Or people who have like comorbidities, but still they have a mild case. So they also are advised to, seek a doctor's help and, get into a COVID care center or a hospital based on their severity of the disease, right? So what needs to be there with the individual who is, say, supposing they do not have any comorbidity, they are not elderly, they do not have any immunocompromised state. They can be safely home isolated. So they need a caregiver to be with them, maybe on a 24/7, because you never know when their symptoms can get worsened, when they need referral to the doctor, and when they need, certain medications or certain food requirements, all of this. So that's why we advise that, there is a dedicated caregiver for them, so that the caregiver also can be screened at a later stage, right? So if there are multiple people giving care, then you're putting more people into the risk, right? And like I said, you constantly monitor. I will show you a slide wherein what are the key vitals that you need to keep a tab on, when do you need to take it, at what frequency, and when do you need to report, and when do you seek help, right? So we'll move on. So what about the COVID affected people, right? So what do they actually need to do while they are home isolated people? So let's say there is a mild case of COVID, and that person needs to take all of these precautions that I'm going to tell you now, right? So they always have to wear a medical mask, right? So here, if you see, here we're talking about a triple layer medical mask, right? Because this is a patient here, and you don't want him to disseminate any viruses to the others, right? So then the same dictum holds good for them, right? They discard the mask if it's wet, or if they're using it continuously for 8 hours, they have to change their mask, right? And the mask in all of the, if they're using gloves, they need to be disinfected with 1% of sodium hypochlorite, and this is readily available in the market. And they preferably put it in a separate garbage bag and discard it, right? Then what do they need to do? They need to be, they need to isolate themselves basically from the elderly and the comorbid family members that are there in the house in a separate room, which probably has a toilet, attached to it, just for their ease, so that, now we've seen that, yes, it is being isolated, the virus is being isolated in the urine and the feces. Though it is not being infectious, by God's grace, it is being discarded. So what should the person take as precaution? So definitely he should take his medication, he should have a good meal. If his appetite is not so badly affected, he should have a lot of fluids, he should take adequate rest, right? He should also follow the respiratory etiquettes. Anyway, he's wearing the mask, still he should do that. And he should also frequently wash his hands with soap and water, or if not available, or if not required, then he can use a sanitizer as well. And he should also not share his clothes or his utensils with the other individuals. Until he is in this isolation for 2 weeks, he should keep all of them separate in his room, which is, kind of segregated for him, right? And if there's any surfaces that he's touching, like, somebody is delivering the food to him and he's touched the knob, then, he should probably cleanse that surface again with the same 1% sodium hypochlorite solution. And he should definitely keep in touch with the doctor and follow the instructions explicitly, right? And he should do a self-monitor on a daily basis. And if there's any change in the vitals, he has to immediately report the same. So for the caregiver, what precautions has to be taken, right? Like I rightly said, it's better to have one person taking care of the COVID patient. So that person has to mask up definitely with a triple layer medical mask. And it should not ideally be in the same room, but when the care is required, they can be there and then they can immediately come out and sanitize their hands, right? And the front portion of the mask should not be touched at any point. If at all touched by any reason or by mistake, should immediately wash their hands, right? And the same holds good for them. So it gets dirty, they change their mask and they discard it separately. And they should avoid touching their face, nose, and their mouth, right? And hand hygiene, of course. It should be strictly followed. It should be followed while preparing food, while attending to the person, while, using the toilet, or whenever they feel that their hands are soiled, right? So same thing for them also. Soap and water and alcohol-based sanitizer holds good for them. And they can use maybe disposable paper towels if there's too much laundry to be done. So that can be done and discarded separately, right? And even the gloves, like I said. So the mask and the gloves will definitely go into a separate garbage, and all of the other waste will go into a separate garbage. So moving on to, the same guidelines. So what happens when they come in contact with any body fluids or anything like that, right? So first of all, they should avoid doing that and immediately sanitize themselves once they actually come into contact with these body fluids, because we see that there is a chance of getting themselves exposed. And if at all it happens, it's better to get themselves also tested for COVID-19, right? And also, of course, they shouldn't share cigarettes, they shouldn't share the utensils, clothes, or dishes, or whatever that is there, which is being used by the patient who's being isolated. Food should be provided separately to the patient themselves, and they can have their set of dishes, and probably it could be kept on a table, and you could call the person, and maybe they can pick it up once you leave the place, and they can close their doors after that. So, precautions like these can be taken, right? So the rest is the same, of course. And like I said, so food waste. So what happens to the, if the patient has any food left? So that can also be packed into our regular covers, which are these black colored covers, and they can be disposed separately, right? And it's good to, if you're staying in a gated community, to inform the janitor who's picking up the waste that, this is COVID infected, so that they also take their precautions and, we kind of break the chain there. So what happens if, the family members need any support, right? So they also should check their vitals every day. They should check their temperature and their saturations every day. And if they see any new symptom, right, any deteriorating symptom, they should definitely seek help immediately. And like I said, they should get themselves tested for COVID. So we went through the precautions, right? So I was telling you about what to monitor, and when to seek help. So this is a small little table that I've put across for you. So what is it that the patient or, the caregiver or other family member should monitor? So they definitely need to monitor their body temperature, right? They need to measure their respiratory rate, right? So for the body temperature, you can use anything like a thermometer, the digital one or the manual one that you have. So if you're putting it in your mouth, I've given you the guideline for that. If it's put in the armpit, there is a different guideline for that. That has to be taken a note of, right? So these are the categorization based upon the recording that you get. We classify them as mild, moderate, and severe. So it goes without saying that only the mild illness are going to be treated at home. The moderate and the severe definitely need to seek doctor's help, and they will be, triaged and positioned in different care centers. So the respiratory rate. So how do you check for the respiratory rate, right? So you can just place your hand over the chest, and for an entire minute, put a stopper on your phone and just check how many times your chest is raising and falling down. So this is the way to measure the respiratory rate, and you need to do this for 1 whole minute. Okay, so this is the normal that is there. So when is it mild and when do you need to seek help, right? And the third, of course, is the oxygen saturation, right? So it's good and it's advisable that everybody has like a portable oximeter at home, and we all know how to use it. So sanitize it before everybody is using it. Sanitize your finger also. It's usually put between the index finger and it's kept there in position till it gives out a recording, right? So, and these are the criteria for when to care and when to seek help. So when do you actually need to seek help? So what are the symptoms that you need to watch out for, right? So one definitely is a high fever. So a high fever which is hitting more than 101 degree Fahrenheit with medication, mind you, okay? Or if it is 103 without a medication, we need to seek help. Second, if there is a severe persistent cough. Third, if there is a breathing difficulty, right? Excuse me. Fourth, if there is a chest pain. Five, if they have extreme weakness, right? So if the person isn't even able to stand and talk to you and tell you that they need support, then they're extremely weak, okay? Or if he's not able to do the routine things that he was regularly doing. Sixth is giddiness, any loss of, that faint nearness feeling, right? And if they have any mental confusion, if they're, and always it's good to keep in touch with the patient and talk to them over the phone and understand what they're doing. So you definitely can pick up signs like these. If they're sounding a little confused, if they are a little disoriented, they do not know what time of the day it is or what day it is, or if they're not even answering at all. So this is when you need to take immediate help of a doctor, right? And if they have slurred speech, or if somebody has had a fit, a normal person, a person who's already had a fit, also you need to be careful. But if a person is a normal person, has never had a fit before, throwing out a fit, yes, it is a warning sign. Or if they complain of some weakness or numbness around their face or around their limbs, you have to definitely take care. And if there's any bluish discoloration around the lips or the face, maybe you can do a video call and check on the patient once in a while, right? Then definitely we need to seek help. So this frequency, like I said, all of these parameters need to be just done twice, unless required, at a more frequent time when your doctor has told you so. But to do it once in the morning and once in the evening is good enough, right? Are there any questions around the stages, or should I just move on?
No, Doctor, there's a bunch of questions. So firstly, thanks for covering.
Yeah, go ahead, Tejas.
So to all the audience, I think a lot of questions were there on symptoms, etc., which doctor has answered. I will take a few which doctor has not had a chance to cover, and in case there are more, just please keep typing it in the chat window. So first, sure. Doctor, at what stage would you recommend somebody to go for a CT scan if somebody is asymptomatic and has mild symptoms versus somebody who has more symptoms? At what stage should we really go to a CT scan?
Understood. So that's a very tricky question. Okay. So all we need to remember is now we're seeing cases which are testing negative on RT-PCR, but still they have some clinical symptoms, right? So we went through the exhaustive list of clinical symptoms, right? So if there's definitely a person with a fever, cough, and a cold, and who's looking sick but is still showing negative on the RT-PCR, then a CT scan needs to be done. Okay, a high resolution one. So in certain cases where this is happening, clinically we are, kind of diagnosing them by the clinical features and the CT findings, right? So this is also being used for diagnosis nowadays. Anything else, Tejas?
Yeah. What are the chances of a COVID recovered patient getting caught with the disease again? And is there a time window that you are immune or something?
Yeah. So to answer that, right? So if there's a person who's had a COVID infection earlier and who's kind of recovered, right? When do we call it a reinfection? So if the person has an infection or has symptoms after a month of when he's caught the first episode, that is where we call that as a reinfection. Or if he's had symptoms for a while, but he's gone for his testing and he's had 2 negative samples, but still after that he gets a positive one, right? That's when we call it as a reinfection. And yes, unfortunately, there are chances of a person getting reinfected with a COVID, though he's been had a COVID episode earlier. That's why we are so much reinforcing on social distancing, masking up, and sanitization, right? So even if they have got COVID once, or even if they are vaccinated both the doses, still they have to follow these norms because the virus is still not there. Gone, right? And we still have not achieved kind of herd immunity that we want to, so that we can just maybe throw off our mask. So that's why it is so important to have all of these physical barriers along with the anything else? Just
is home quarantined and the patient room, should it be ventilated, or should the windows, I mean the person who's kind of home isolating in a separate room, should that room have windows be open? I mean, how I mean, does this stay in the air, and there's a chance of kind of infecting, through the window?
Right. So it depends on where the person is, right? So if the window is actually opening into the living area of the rest of the family members, then it should be kept covered, right? So it is a case by case basis. But if they have a ventilator which is like higher, and if they live in an apartment like maybe on the 10th floor, then it's good for them to keep that open. And if it's opening out in the open, right, if they do not have adjacent buildings very close by, then they can keep it open, because that helps in their ventilation as well. So it depends on case-to-case basis.
Doctor, any special precautions and for toddlers and for pregnant women? I mean, two separate groups, but say 1 to 2 to 3 year olds who probably are not able to speak or express, how they are feeling. The readings that you have, or fever, the numbers that you mentioned, should we look at anything different for very
for the younger children? Yeah. So. For that, fever is a good index, right? So luckily we haven't seen any infections in such small population. More so it is kind of affecting the 20-30 year age group. So we have not seen that in toddlers as of now. But if there's anybody in the family who's already affected, who's already home isolated, then fever is a good index. Because for fever, it's the same, right? And we don't have to actually worry about the other oxygen saturation and all for the toddler. That's not required. But fever is something that the mother can definitely pick up. And of course, for the pregnant women, like I said, right? So this is one population that we have to actually take care of. I'll tell you why. Because, for them, the medical care also, we do not have so many studies. We can't offer them vaccines, and we have to keep them kind of isolated till their delivery time, right? So it's better to, keep them separately isolated from all of them. Even if there's anybody with or without COVID, I think they need to be extra cautious on that. And they should definitely get in touch with their gynecologist and, understand how they can reduce contact with, maybe during consultations, having a video call, and only go in there if required, right? Because we have a bare minimum a number of antenatal visits also. Maybe they should talk to their doctor about that.
Okay. Thanks, doctor. So thank you very much. There's a bunch of questions on vaccination, but I believe we're going to cover them. So maybe.
Yes, we will. So we will take it up once we move on to that subsection. Yeah.
Thanks, doctor.
Thanks, Tejas. Wonderful. Thanks. So, just to give you a little brief about, I wanted to put a little slide about, what are the tests that we do to investigate oneself for a COVID vaccine, right? Sorry, COVID infection. And how do we diagnose it? So, like I mentioned, the first thing, or the gold standard for diagnosis is a RT-PCR test, right? But it does have a window period of 5 days is what we've clinically found out. So if that is why I just told you that, if there is somebody who has an overt clinically, if you look at them, they look sick, right? But their RT-PCR is coming negative. So what they need to do is they definitely need to seek help, and upon the doctor's advice, they have to get RT-CT done of the chest, right? So we've seen that, CT changes are coming in much more earlier and much more evident than the RT-PCR. While, of course, the specificity and the sensitivity, if I have to talk about RT-PCR test, is definitely a top notch, right? So that is why we call it the gold standard. Otherwise, it would not be, right? So there are certain percentage, say just 2% is being, coming out as false negative or false positive. But otherwise, there is a specificity of 98%. So it holds good as the first line investigation, right? So if you want to know about the current infection, that is, what are the other diagnostic tests to pick up a current infection? There is a random antigen test, right? So this is done when you quickly need to do a test, right? So there is a patient who's come to a doctor and he's kind of sick, and you really want to know his status, because then you don't want to put the entire healthcare fraternity into risk, right? So that's when we do a rapid antigen test. Third is when, like I rightly told you, when the RT-PCR is negative. I've already covered that. And there are also certain serum inflammatory markers, okay? So I've mentioned that beneath in the third point, wherein, there are certain blood tests which can be done. So like our regular tests that we do along with the CBC, right? So there are these inflammatory markers which are showing rapid increase around the second week of the disease, right? So first week, maybe the person has all of these symptoms and they move on to the second week. The second week is when we are seeing these rise in these inflammatory markers. So what are they? They are like the C-reactive protein, they are the D dimer. So these two are the most sensitive, and then followed by the interleukin-6, which is not so sensitive, but is still being used in clinical practice because it is picking up certain cases, right? So how do you identify a person who's had a past or a previous infection, right? Say, supposing you want to know whether the person has developed antibodies, like we just spoke about reinfection, right? So they've just had a COVID and they just recovered after 14 weeks. They've, got back to the pink of health, and they just want to know if they've developed that kind of antibody titers, right? So then an antibody titer can be done against the COVID-19 vaccine. So they would have developed antibodies. So you can figure out by that whether they have like a proper immunity developed or not. But still, that goes without saying that they cannot relax on the other physical barriers against COVID-19. Okay. So we'll move on to the vaccination bit, which is probably the key piece of the session today. Any questions, Tejas, or should I move on?
Doctor, I think we'll do the vaccination part and then take
Done.
the next one. Yeah.
Done. So I just put a little snapshot of today's status as of now. So see, there's a lot going on in our minds around vaccination, right? So this is just a snippet, as in to show you how many people have actually got vaccinated, right? So this is a huge number for us to kind of slight. So definitely the vaccination is come out and is proven as a good precautionary measure along with the rest of the things that we've just seen, right? So just to give you a brief about how we started off the vaccination drive, we started it in on the 16th of Jan this year. We've completed 3 phases. First, it was offered to the healthcare workers and the frontline workers, which are like, the BBMP, the police, and the military officials. Then the second phase was around for the general population, right? So more so around the senior citizens with or without comorbidities and the individuals who were the middle-aged, right, with comorbidities. And then it was offered to everybody above 45 years from the since the 1st of March. Right, so we are in the third phase wherein the vaccine is going to be offered to the general population for anybody who's above 18 years from the 1st of May 2020. So let's see, what is it that we have, to know about these vaccines, right? So what are the available vaccines? You all know it by sure. I don't have to tell you that. It's a Covishield or a Covaxin, right? And later maybe down the phase, we might get Sputnik. Right. So what is Covishield? Covishield is a virus vector vaccine, while Covaxin is an inactivated killed vaccine. Okay. So what are the number of doses that we have to take? All of us know that by now we need to take 2 doses. But there's a slight change in the regimen now, right? So with Covaxin, the second dose is taken 4 weeks apart, while with Covishield, it is recommended to take it 6 weeks later. So we've seen that, they have better immunity and they have better infection resistance power if they are given at a frequency of 6 weeks now. So this is what you need to remember. So if there's anybody who's taken Covishield or Covaxin in the recent past, you have to tell them this, that the second dose is either 4 weeks or 6 weeks apart respectively. Okay. Then when will the protective level of antibodies kick in? So the first dose of vaccine does give us 80% is what the studies say. But the second dose and after 2 weeks of the second dose is when the actual antibodies start kicking in larger proportion, like a 70 to 80% of protection is seen after 2 weeks after the second dose. Okay, so this is what you need to keep in mind. So now we've said that the entire general population is getting it. So anybody above 18 years, while we said we are still keeping it reserved, we're not giving it to the children and we're not giving it to pregnant and lactating moms. So who are the people who should not take the vaccine during this drive? So this is something which is interesting and that we need to know, right? So there are different ways of seeing this. So there is a provisional contraindication, like how we say in medical terms. So for 4 to 8 weeks, they have to deter themselves from taking the vaccine. They can take it after 8 weeks. Okay? So who are they? They are people who have like an active symptom of COVID-19. So we went through the exhaustive list, right? So if they currently have any of the symptoms, or if they feel that, they could be exposed to somebody who's a COVID-19, better to deter taking the vaccine. Or if they're already home isolated, or if they're self-isolated themselves, right? Or if they've actually they are suspected that, they might have an infection and they've given their blood sample out there for testing. They should await the result, right? And individuals who have kind of taken any therapy. So say they were hospitalized, they had a COVID infection, and they did take a plasma therapy. So they all should deter from taking the vaccine for a period of 4 to 8 weeks, and then probably talk to their treating doctor and then go ahead with it. Or any other active illness, right? Apart from COVID, now the whole world is focusing on COVID. But apart from that, also other acute humble infections, it could be a respiratory throat infection, which is not a COVID, right? Even then, that is what the general dictum is for any other vaccination. When anybody is sick, we deter from taking it. So that general principle holds good for COVID vaccines also. Second thing, what is the absolute contraindications? Means it is an absolute no-no for these people to take these vaccines, right? Like I said, pregnant women, lactating mothers who are nursing their babies, and there is also a population who has been, who have encountered an allergic reaction to any of the previous vaccines that they've received throughout their life, right? So all of us have, undergone these national immunization schedules, right? So any injectable vaccine that's given them a rash, that's given them any kind of allergy, that's, kind of maybe given them an episode of giddiness. So these are things that one never forgets, right? So that is where we need to be very, very careful. And where if there are also allergies around any other medication, right? So you might hear somebody say that, I'm allergic to these sulfur drugs, I can't take them, right? Or if they have any food allergies. So, some people are allergic to fish, some people are allergic to brinjals. Even if they have any known allergies, they should not take the vaccine. What they can ideally do, we have seen studies, is that, you can talk to your treating doctor. You can probably also consult an immunologist who is an expert in allergic disorders. And, you could probably take a test dose of the vaccine and see if it is not causing too much harm. And then you can go ahead and take the vaccine. Okay? So we'll move on. So I've continued the contraindications here. Okay. So who are the special cases wherein, under strict medical supervision, they can take the vaccine? It is not so an absolute contraindication like we just saw earlier for pregnant and lactating and allergic people, but they should take precautions and they should ideally go to a setup where there is a doctor who's monitoring them while they are taking the vaccine. Okay. So who are these individuals? Individuals have any bleeding disorder, any clotting disorder. Okay. So these are some things that we just will not forget, because they definitely know their condition. It is a diagnosed condition, and it would have been there for a long time with them, right? Or anybody who's had a recent blood test done, a recent CBC where they've seen that their platelet count is low, they also should be very careful. Or if they're already taking medicines like the ones that I've listed here, okay, if they're already on aspirin, talk to your doctor. If they're already on chloroquine, if they've just had an attack of malaria, maybe if they're already on corticosteroids or steroids generally to say, or certain beta blockers, because beta blockers are used to, treat conditions like hypertension and, BPH and so on and so forth. So then if you're on any medication of these that I've mentioned here, please talk to your treating doctor, and only then, if under strict medical supervision, will you go ahead and take the vaccine. Okay. So these are the criteria as in who's eligible and who's not eligible, right? So next we'll move on to the side effects, right? See, so all of us know that any medication or any vaccine will definitely have a side effect, right? So this is something that we have to keep in our mind, and we are going ahead with the vaccination. Why is that so? Because the benefit is much more than the risk that it has to give, right? And what are these side effects that we've reported so far and that we've seen, right? So they are very mild. So anybody taking a shot, or even if your child is taking a shot, you will see that the day 2 will be, a little cranky. There'll be a little pain. There'll be a little redness, a little swelling. That's all that you're going to experience after the first dose or the second dose of your vaccine, right? Some people can get a fever. Some people can get a fever with a chill, feeling cold. Some people can get a general malaise or the general, sick feeling that we usually get, that they can have. Some people can get a muscle pain. Some people can get a body ache, a generalized body ache, right? Or some people can get a joint pain. Some people can feel a little more fatigue. Some people can have a headache, maybe day 1, day 2, right? Or some people can have cold and cough itself. So they can have flu-like symptoms. So don't get worried, right? Unless it's not bothering you too much, right? And also it is good to take a pill of paracetamol. So it is being dispensed at every center that is being vaccinated. So unless you're allergic to it, talk to the doctor, know what medication to take, have a free chat with them, and then only go ahead and take the vaccine, right? So these are some mild side effects that have been noted with both the vaccines, equally Covishield and Covaxin. Yeah, and also if you're trying to decide as in which vaccine is good, right? So both are equally efficacious, both have equally undergone all of the phases of the clinical trials, and both of them have almost the similar percentage of efficacy there, right? So let's move on to any myths and facts. So I just put in a few myths and facts that would generally come into your mind, right? So should we go ahead with the myths and facts, or should we just take the questions, or how would you suggest,
Tejas?
Just a couple
of questions, Doctor.
Yeah, go ahead, Tejas.
How long are the vaccines effective? Like after the second dose, is there a timeline? Like it will be effective for say 6 months, 9 months, 12 months, or whatever? Right.
So that is a question that, unfortunately, we clinicians do not have an answer for as of now, because we're just going by the facts and figures that we're being studied upon, right? So we really do not know whether, this virus is going to give us a lifelong immunity, whether it's going to give us an immunity for a period of 6 months or a year or so on and so forth. We really do not have that kind of data. So that kind of data will be put in the public domain and will be explained by your doctors as soon as it's available, because a lot of studies are going around it, because we really do not know how the immunity is behaving, because we do not have that kind of sample size to study upon it, right? But having said that, there is a ray of hope. But just look at it this way, right? So though we give our children a DTP, right, which is a diphtheria, tetanus, and a pertussis vaccine, right? We give them a booster dose, right? So look at it that way, right? So we can still have a ray of hope saying that, once I've taken the vaccine, my first shot and my second shot, I do have a protective immunity, and I have a appreciative and a significant amount of protectivity, right, against the vaccine. Against the virus. But what do I do later on? Maybe I need to take a booster, but that's all it is, right? So we should see the positive side of things also, thinking that, we have limited scope for these studies and analysis. Anything else, Tejas?
Sure. Yeah, there's a few more. Just one note.
Go ahead.
We are almost at the end of time that we had scheduled, Doctor, and all the audience. So
yeah, this is
I would request if people could stay on. I mean, there's still a lot of questions that are coming in.
Wonderful.
Some of them have been answered. Some of them are I'll continue to take. But
sure.
If we could request people to be, whoever is interested to be, on for 15 minutes, and the same with you, Doctor.
Yeah, I will definitely stay on. I'm so sorry for taking so much of your time. Sure. It's just that the subject itself is so vast. So we will
no worries.
The myths. Thank you.
Yeah, we can finish the myths, and then there's a few more.
We'll have questions after that. Yeah, sure. And what is remaining, I just wanted to tell you. So after the myths and facts around COVID vaccination, I just have one slide on the management, just for completion's sake, and a small little note about what to expect post-COVID and how to manage it. That's it. So moving on to the myths, right? So there is a myth that is there. Will vaccine cause any problem to the woman's fertility? Or, there have been certain rumors going around erectile dysfunction in men. So they are false claims, right? So that is not the truth. It does not affect the fertility in women, nor does it cause erectile dysfunction in men. So moving on to the next myth, right? So if a person is already infected with COVID-19. So the person might say, I'm already protected. I don't need to take the vaccine. But here we've seen that even with COVID positive people who've just recovered from the disease, they should take vaccine, because that's giving them an extra layer of protection against the virus, right? So why not go ahead and take it? The third one, right? So we've seen that, we all know, right? Vaccines have, for them to get discovered and developed, it takes years together. We have history to prove it. But this vaccine has come down even less than a year, right? So we may have our doubts in it, right? But not at all to worry. Like I said, the efficacy is 90% and above, and it has undergone all of the clinical phases of clinical trials, and only then has it got a thumbs up from the government and the global bodies who are doing these studies and these analysis. So please be, have trust on it, right? So the next one, moving on. Should I lower my guard? Should I not wear my mask, or should I not take further precautions? Absolute no to it. So like we've been learning, and like I've been reiterating, we have to continue with these physical barrier methods. We have to mask ourselves. We have to maintain social distancing, and we have to sanitize. The next one, right? So getting the COVID vaccine can get COVID-19. So this is also a myth, right? Like I said, small amount of cough and cold can happen. So, people spread the rumor saying that I did get COVID after the vaccine. That ain't true, right? So these are symptoms which are definitely seen and which are the known side effects after any vaccine, right? And so also with the COVID-19. But it is not a COVID-19 infection unless proven otherwise. So you can safely go ahead and take it. And what's the last thing that I wanted to actually tell you? See, so there's a lot of these talks going about, this is the mRNA virus and so on that is being injected. So will it kind of go into my system and, change my genetic makeup? No, it will not do anything like that. And it will neither interact with any of our innate genetic coding, right? So that's also a myth. It's not a fact. So I'm done with the myths and facts. If there are any questions, I'll be happy to take it. I just have the management and the post-COVID care. Go ahead.
Sure. There's a few more on vaccines, Doctor.
Yeah, go ahead.
The first one is for people who have recovered from COVID. I know you did mention about them. How soon can they take the vaccine? And if yes, do they need to do both the shots?
Yes, definitely. For them also the regimen is the same, and they have to take this as soon as they are out of their treatment. So like I said, they have to deter from the vaccination for about 4 to 8 weeks if they are in the active phase of the infection, or if they've just taken their treatment. Of course, if they're hospitalized, they will not be vaccinated. But apart from that, after 4 to 8 weeks, they are eligible to take the vaccine, and they definitely have to take 2 doses of vaccine like any of the general population.
Okay. And Doctor, there's news of vaccine shortage, etc. So in case, because of unavailability of vaccines, the second dose gets delayed beyond the stipulated timeline, what's to be done? How to handle?
So that's a very good question. So I'm sure the government is taking its measures, and the healthcare system also will do the needful. That situation will not arise, but still, there's a rosy side to it, right? So we say that the second dose, like I rightly told you in the slide that we discussed, so Covaxin is spread apart by 4 weeks and Covishield is spread apart by 6 weeks, right? So 6 to 8 weeks is where it is actually recommended. But if it is actually getting delayed, the better for you. But don't take my point and don't delay it on your own. But if there is inavailability, if there is more than, maybe a month in between or 3 months, don't worry. Your immunity system is just going to kick in much better. So don't worry about that. But always remember to take that second dose, okay?
Sure. Thanks, Doctor. Doctor, about this vaccine side effects on blood clots and all, I mean, is it something to be worried about? For
As in blood clots, I didn't understand. The condition, it's you're saying the local clotting.
No, there's some news around this Covishield having some side effects around blood clots, and also is it something that people should be worried about? Or
no, it hasn't been come out in the studies. It is less unlikely. It's very, very unlikely. And I am a living example. I've taken both my shots of vaccine and I have taken Covishield. So absolutely not the truth. And it is not documented also in the adverse effects. So don't worry.
Okay, sure, Doctor. The other thing,
Anything
Doctor,
else, Tejas?
The other thing was this is about prevention actually, about the N95 masks. I know there's been a lot of study around the N95 mask. There are some questions around how many times one can reuse it, or is it like to be discarded after a certain duration or something?
Yeah, it is better to be discarded soon after. It's only for single use, right? So it shouldn't be used again and again. There are certain people who are like washing it and reusing it. Ideally, the efficacy will come down, right? So you don't want to do that. That's why I said an N95 mask is really not required. Only it's required in these following situations, right? So if you're going into a crowded place where you feel like, it's going to be a huge risk, or when you're getting into hospitals, or when you're taking care of another COVID patient, then you might want to consider an N95 mask, but it's really not required. A general mask a cloth mask which has like a triple layer for the ones who are caregivers for COVID, but otherwise a general mask which has like a decent 2-layer of cloth and a mesh or something can keep you equally protected. But we need to know the right way of wearing it, not keeping it guarded down from the nose and the mouth. That doesn't help at all. And also if it is soiled, immediately change it, right?
Okay, sure.
Please do not use these disposable masks that are there. Please do not use it. I see many people reusing it again and again. That absolutely is of no value. It is disposable. So the word itself says it is for one single time use. So please do not use these surgical masks. They are really of no use. A cloth mask can do much better benefit to you if used properly.
Sure. Doctor, then there's been again some press about after you take the first dose of the vaccine,
okay.
I mean, the chance of catching COVID increases or something. I mean, is it? I mean, of course, we have to follow all the normal precautions, but is it something more specific that we have to do after taking the first dose and before taking the second dose, or just continue? I mean, everything like the way you would. I mean, you have advised.
You rightly said it. So there is absolutely no different thing that we do. We follow the same norms and we just keep ourselves safe. That's all we have to do. There is no extra precautions that we have to take between the doses or even before the first dose.
Okay, sure. Doctor, the other thing about, currently since there's, news of shortage of beds and oxygen and things like that, in case somebody is having a patient at home, and you see that the oxygen readings, etc., are going down.
Right.
What are some of the remedies at home one can do until the hospital bed, etc., is available?
Right, that's a very good question. So I would just want to step back and answer that previous question. So certain precautions, like you said, right? So before taking a vaccine, since now it's open for all the general public, right? So if they are on any other medication, the regular medications, please take that before you take your vaccine that particular day. Right, so if there is a hypertensive who's taking their BP tablets, or if there is a sugar patient, please take your regular medications on time. And please see that your known conditions are well managed. That is one precaution that all of us can take before the vaccination. It will help us. Right, so to answer your question, Tejas, so the thing is, say, supposing there is somebody who has a dire situation and the saturation is dropping. So the cutoff, like I told you, now the latest guideline to 22nd of April, what has come down is 93%. So if there is a dip from the 93% oxygen saturation is when you need to seek help. But in the interim, what can you do? You can definitely keep a nebulizer handy, right? And you can talk to your doctor about certain medications that they can use in the nebulization panel, the medicine panel, and keep taking that till they reach help. So that can definitely be done. And you should talk to your family doctor, your treating doctor about the same.
Okay.
And one more thing that we've also seen, which is proven beneficial, is this prone self-care. So you all must have seen that, right? So there are people who have their own sleeping postures. So kudos to the people who already sleep on their prone posture. So probably you can put the patient on the prone posture, which is lying on their chest and their tummy, right? So you support them by pillows. So keep one pillow just beneath the chest, and keep one pillow maybe near the thighs and one just beneath the legs, right? And you ask them to breathe. Just do deep breathing exercises and just reassure them that you are seeking help. And I think it will do the job.
Sure. Doctor, there's one more around.
Yeah,
so right now, since the cases have increased, most of us are probably living in communities or apartments where we have either a neighbor positive or somebody who's positive very, very close. So is it safe to go for, I mean, if you were to step out for say even a walk, or should one ideally just avoid all of such things?
Right. So these situations are commonly seen nowadays, right? So ideally what they should do is the family who's affected, right? So they completely isolate themselves at home. So ideally we should strictly tell them that, you can contain the infection that way, so that, the rest of them at least get a leverage to move around, right? Otherwise it gets very difficult to maintain. And also these common areas need to be fumigated at least twice in a day, right? So the lift areas, the staircases, the corridors, the terraces and the basement area and all of that, irrespective of whether they're coming out or, not, it should be fumigated twice a day. throughout that isolation period. So as and when these cases start, deterring from the home isolation, this practice can be stopped. But then that is one thing that we can safely do. And the other thing that can be safely done is mask up yourself when you're going out, right? And if you really have to go. But otherwise, it's best to, stay put at home and do the regular activity within, the space that you availably have. That's the ideal thing to do. But if you still, maybe if you want to take care of the boredom or something, you just want to take a walk, mask up yourself and don't stay, close to anybody, any stranger in that safe distance. So maintain the distance. Don't stay with them for more than 5-10 minutes and just say a hi, hello. It's better not to chat at all. But then if you at least come across someone, just say a hi, hello, and just move on. That's the best thing that you can do.
Sure. Thanks, Doctor. I think we've covered quite a few questions, Doctor. Maybe we'll just finish this slide. I think you have this one, or I think the last one.
Yeah. So this is the second last slide. So I'm so sorry, guys. I'm taking a long time. So just on the management bit, right? So I just wanted you all to know what is the medication or the management that we are actually giving these patients, irrespective of which grade they belong to. These are the general medications that we are offering, right? So it is definitely the fever medication, the antacids to bring down the gastritis, cold and cough medicines. Then we have antivirals that are being used, and antibiotics are also being used for the super added bacterial infection. And of course, like the multivitamins to just supplement. Steroids are being used to control the inflammation, like I said, which is kicking in the second week. There are anticoagulants because we see that the second week, because they're lying on the bed for a long time, they could be prone for, thrombotic events. So we're trying to prevent that by anticoagulants. And of course, supportive therapy, like we're doing in the home care also, which is steam, gargling, and nebulization. And a little note, this is my last slide, a little note on the post-COVID complications, right? So we see that, certain mild to moderate patients that are there are still having a prolonged duration of their illness sometimes, right? So it could be they may be experiencing certain tiredness, some amount of cough, some amount of chest pain, some amount of breathing difficulty. Maybe some people are not able to get back to their routine of exercise, headaches, and so on and so forth. But it's just a matter of time for them to, actually get back to their routine and for their immunity to get full blown and to ward away all of these complications. So what can we actually do to support these individuals who already gone through a COVID episode, right? So give them support, of course, give them good nutrition, give them good rest, and, give them that support that, they're going to recover very soon and they will not need any of the medical care anymore. And still, if there are any of these symptoms, like I said, if they have breathlessness, if they have, chest pain, if they have cough, if they have anything that's persisting, it's not bad to do their pulse ox, like, monitor them and again seek help if there is any of the warning signs that we've just gone through. And of course, if there is anything which is, around the vital systems, which is the respiratory system, the cardiac system, or the neuro system, any new symptoms that have come by, right? So say, for example, there's been a person who was like normal all these years and he's had a COVID. And after that, the family member kind of notices that he's always confused, disoriented, doesn't kind of respond the way he does, or kind of low on his memory, then that's a new symptom. Okay, that has to be recognized and has to be reported to the doctor and has to be taken care of, right? And we've seen that breathing exercises during or even after can definitely help the individual keep up their lung capacity, and is also helping individuals ward off all of these symptoms. And of course, not to add or not to miss the good nutrition, like we saw, consumption of at least 3 to 5 fruits and vegetables in a day, according to WHO standards. All of that we keep the same way, right? And one small little note is maybe, data from any acquired habits that anybody's already picked up, like, maybe smoking or so on and so forth, because it's not really helping people out in the recovery phase. And also talk to your doctor before you take any new medication, be it pain medication or any other new medication for any symptom. Do have a chat with your doctor and know that it is safe to do or safe to take in the first place, and then only take it. So I'm done, Tejas. A big thank you to all of you all for the patient listening and the opportunity, and for all of your valuable time. I'm happy to take any questions that we have.
Sure. Thank you so much, Doctor, for taking time amidst this kind of a situation that we are all going through. I had one last question, which was around plasma.
My pleasure. Yeah.
So the question is basically, is it safe to donate, and by when? I mean, when can one donate after one has been cured?
Right. So plasma is safe to donate, right? The first thing. So we are kind of seeing, though I would just want to give you a note that it is still being in the experimental studies, right? So who is offered plasma therapy? Okay, somebody who's like moderately severe or who's like in the severe disease, where all of the above therapy is tried and tested and it's not working, still the person is kind of dipping, then we actually kind of offer it, but it doesn't show so much of a therapeutic value. Okay, but still, having said that, after a person has had a COVID infection, after the person is free of any symptoms, 4 weeks or 4 to 8 weeks after they've had the infection, they can go ahead and donate the plasma. And if you want, I will share a document with you, which I've prepared just on plasma therapy, so that you can have a quick read around it. And if there are any questions, I will give you my mail ID. You can drop your questions directly to my mail ID. And as and when time permits, I will answer the same to you. Rather, I will respond.
Sure. Thanks, Doctor. Thanks again from all of our sides.